after bowel movement is not normal, and it is definitely not a digestive issue. What's actually happening is your overactive pelvic floor fails to relax during defecation. That's what's happening. So the question is, well, why does it fail to begin with? Well, it's failing because the environment that allows it to function properly is not there. Your nerves become hypersensitive after a strain, after going to the bathroom. So why would the inside structures not function properly? Well, if the inside is being compressed because the muscles on the inside are tight, then whatever resides on the inside is going to be impacted negatively. What resides there are your intestines, your bladder, your prostate, ovaries, uterus, depending on what gender you have. There are arteries, there are veins, there are blood vessels, there are joints, there are ligaments, there are of course muscles, there's sphincters, all of these, and then there are tubes that allow the urine to go out or for urine to get in. So that they are all in here. And so when this area becomes tight, all of those things I just named can be compressed and malfunction. When you're defecating, when you go to the bathroom and after a bowel movement, you have pain, there is no relaxation there. Or maybe muscles relax, or the muscles that needed to relax for you to have a bowel movement are uncomfortable relaxing. Or the muscles that need to contract to basically close the sphincter do not close properly. It's an effort, so it comes with pain. What needs to happen is we need to change that environment and bring stability back into the picture so these muscles have a chance to relax. This is what nature does, and that's the key here. It starts with biological breathing. Your breathing, imagine at a frequency of every breath, we assure that the muscles on the inside relax and the same muscles are conditioned to breathe out. So if anything in your body is being reinforced at a frequency of every breath, you can bet your life that that function is important for your existence. So what we need to look at is, where is the instability? How extensive is the instability? Put your head down and follow how nature established stability. The way we establish a stability that we know of is by studying human babies. You and I, every walking human being on the planet Earth starts as a baby. We can barely hold our heads up. Through a systematic progression of movement, we become stable, we get on our feet, we start walking, and heck, we start running. Every single one of us follow that format. So that means if I have a problem with stability of my pelvis and my body parts, which are connected to my pelvis, then I am going to follow the same pattern that established stability to begin with and see where I stand. That means you learn what right looks like. In the process, you learn what your version looks like, and you learn how to grab yourself from the default mode and create that positive right position for your body. This is called developmental exercises, which is what I do. I have done so many videos on pelvic floor dysfunction, the many phases of pelvic floor dysfunction, and many subtle signs of pelvic floor dysfunction that if you go and watch, you'll see that some of these you can definitely relate to. If you have not subscribed to my channel, make sure you do. If you have subscribed to my channel, thanks for subscribing and following me. But back to the fix. We want to do biological breathing, which is how we relax the area. I'm going to make sure we put the link at the end of this video so you watch it and you learn about it. But most importantly, don't waste your time trying to stretch or to strengthen something when the foundation is not in place. You're wasting your time. First thing first. First thing is mechanics. With mechanics times frequency, you build strength. With mechanics in place, the body does not need to tighten up. These muscles don't need to tighten up. When you breathe biologically, you relax it. When you understand what those proper principles are, then you just make sure you follow them for the rest of your life. If you have any suggestions for more videos, use the opportunity to comment below. If you need help with your pelvic floor dysfunction, use one of the methods of contact in the description box to contact me. I'll be more than happy to talk to you and see what's going on. Until next time, take care.